Thanks for joining me this afternoon. I'm Deb Hutton, your host today for Newstalk Today. And I wanted to talk a little bit about the situation in our pediatric hospitals, specifically the Children's Hospital of Eastern Ontario, which we all call CHEO, and how they're getting through the respiratory virus season, the influenza season that we have all found and I think has been referred to as a perfect storm in terms of what is happening with our children and our children's hospital. I'll tell you, apologies for any of the technical glitches you're hearing today on the show, because I'm actually working from home this afternoon. And the reason for that is my 8-year-old is upstairs. I keep hearing movement on the floor, so she may be feeling a little bit better. But she's home with a cold, and it's no fever, but I kept her home today. I'm fingers crossed she can go back tomorrow. But she's one of the thousands of kids in this province throughout this country who has, we hope, at best a cold, but in many cases, some form of influenza or of RSVP. So to talk specifically about what is happening at the Children's Hospital of Eastern Ontario is Dr. Dina Kulik, who is a pediatrician and founder of Kid Crew Medical. Dr. Kulik, thanks so much for joining Newstalk today.
You're welcome.
So give us a sense overall of what we're seeing this week. And I know these are always often a moment in time snapshots throughout the province as it relates to ERs, to ICU beds for our kids, and for the general influenza outbreak that we've seen.
Sure. So I work in Toronto, so I'm not super familiar with what's happening at CHEO other than what everyone's hearing in the news. But I can say for sure that viral season is definitely upon us. It has been for a couple of months, really, and it's quite unprecedented. There's a lot of sick children, kids like yours and my as well, actually kids that are homesick today with normal viral illness features like runny nose and cough and sore throat and fever. The trouble, though, is that there's so much normal viral stuff happening, but also quite a lot of RSV, a lot of influenza A, and still a lot of COVID. And in some cases, kids are getting multiple infections at once. They have RSV and COVID, influenza and RSV. And because there's just so many of these kids, some kids unfortunately do get very sick with RSV, particularly young babies, vulnerable babies. And so as a result, hospitals are overwhelmed at the moment.
Yeah, and as I said, I mentioned CHEO simply because they are in the news today. They have called on the Red Cross to help them with a hospital shortage next week. A spokesperson for CHEO said that normally, I think they have in the range of 60 beds that are normally there, 41 pediatric beds, and they've been running at 60 to 70 pediatric patients for the last several weeks, with another 10 or 12 in waiting rooms. So obviously our existing system will handle most intake at normal times, but is really falling behind here. Is there a short-term answer to this surge? I mean, obviously CHEO's chosen Red Cross. Are there other things that we can and should be doing that we haven't seen so far to help with this crisis?
I think there's a lot we could be doing at home in our own family. So as you mentioned, your child is homesick. Your child isn't at school sick. And the more we can keep people out of the community who are feeling unwell, that goes a long way. So my child is sick, your child is sick, they're home, they're not at school. If my kids were at school, they would be wearing masks. My kids are exclusively wearing masks at school. They have been since September and actually the last 3 years, really. That also will help prevent the spread of respiratory viruses. So I think a big piece of it starts from home. If your child is unwell, if you're unwell, please stay home if you can. If they are feeling better, not having fever, they're well enough to go to school, please put them in a mask. If they're older than 2, they can wear one, and that will go a long way to preventing the rest of the classroom from getting sick and having this constant round and round of illness.
I'm actually going to go sort of sideways on you here just briefly, but help us as parents understand when we can send our kids back, because kids can have a runny nose or a slight cough for a very long time. Should we be keeping them home at that entire duration?
It's a great question. It's not that predictable how many days someone is contagious for. As long as you're coughing, you have a runny nose, you have a fever, you're probably still able to dispense droplets into the air. If you're coughing, there is going to be mucus and viral droplets heading into the air. Exactly how many days that happens for, we just don't know. Certainly viruses like COVID, influenza, they're probably still contagious at the week or two mark. So they might be feeling well enough to go back, and you might want to send them back. And of course, many parents are working and they need kids to be in school, but that's why masks could be really helpful. So if a child is unwell, that's my strategy. Put my kids in masks. That helps prevent them from getting sick, though not foolproof, but certainly can help prevent the spread of their virus to their friends and their teachers and administrators and everyone else that works in the school.
Speaking with Dr. Dina Kulik, who is the pediatrician and founder of Kid Crew Medical, about what has been for several weeks now and continues to be an issue in our pediatric units, in particular our ICU beds at well over 100% capacity. As someone who works in the system, Dr. Kulik, is it your view that we need to overall increase our pediatric ICU beds, which is obviously not a short-term fix, but that we actually will continue to see, I'll call it oversubscription of the beds? Or is this truly, as I referenced earlier, sort of a perfect storm of ongoing COVID, of a particularly violent influenza season and RSV?
I think it is more the latter. I think we have a lot more viral illnesses in the community at the moment. I think we're all back in person as well without masks, which sets us up for that as well. The issue isn't always just about number of beds. That's a bit of a misnomer. Oftentimes there's enough physical beds, but there may not be enough nurses or phlebotomists or porters or doctors. And of course, if your kids are sick, my kids are sick, many other healthcare providers' kids are sick, or they are sick, so they're off work. So it's not simply a matter of space, which a lot of people think it is, or beds, physical beds or rooms, but rather having enough healthcare providers to care for these individuals as well. So if we have that much virus in the community, a certain number of healthcare providers are also going to get sick, or their families will be, taking them out of the equation, leaving less availability of those healthcare providers to care for people in hospital.
Yeah, it's an important point, and thank you for raising it, because we do think beds, and we think, okay, there's not a physical spot for my kid, when in fact it is the overall care. Are you comfortable with some of the decisions that, as a healthcare provider, that hospitals have taken? So, for example, bringing in the Red Cross, we've just discussed, which is the news today out of the Children's Hospital in Eastern Ontario. In the past, we've seen other pediatric hospitals throughout the province here in Ontario who are taking their teenage patients and transferring them, or recommending that they go to other ICU hospitals for, in quotations, adult hospitals for care. Do you have thoughts on whether this is actually the right approach to give some flexibility in our system?
It goes both ways. During the height of COVID, many hospitals, many kids' ICU beds were taken up by adult patients because they had run out of adult facilities for these individuals. So where we can, we like to help our colleagues out in other areas. One of the reasons why the Red Cross is being called in isn't so much just about how many people are sick, but because they're having to take other healthcare providers from other disciplines in the hospital and have those individuals help in the ICUs to care for these sick children. So if we're depleting resources in one area, that means other things will fall behind. Perhaps surgeries will get bumped. Perhaps other kids that are going for other therapies will have to wait. Perhaps clinic appointments will be moved. So bringing in these additional people from the Red Cross will help minimize how much disruption there is to other areas of the hospital that are being derailed right now because of the crisis in the ICU. So it's a matter of resource allocation. Certainly, we can use a lot more doctors, a lot more nurses, a lot more other healthcare providers in the system. And when people are sick, it takes them out of work.
Dr. Dina Kulik, we thank you for your time, pediatrician and founder of Kid Crew Medical, talking about the crisis in our pediatric units.